I'm Vic Senese, and welcome to UroNurse News. A dangerous respiratory illness, whooping cough, is surging earlier than expected, well before winter even begins. And experts warn this may only be the beginning. Cases of whooping cough, formerly known as pertussis, are rising for the second year in a row. According to CDC data cited by ABC News, U.S. has already seen more than 25,000 cases this year. That's the highest annual total in nearly a decade, and many infections still go unreported. Tragically, Kentucky just reported its third infant death from whooping cough this year. All were infants and none were vaccinated. State Health Secretary Stephen Stack said he is deeply saddened and concerned about the volume of cases spreading throughout his state. So what exactly is the illness? Whooping cough is a highly contagious bacterial infection caused by Bordetella pertussis. The bacteria cling to tiny hair-like structures in the upper airway, the cilia, and release toxins that inflame and damage the respiratory system. That damage can lead to the signature symptoms, a rapid, violent cough that can last for months. Some doctors call it the 100-day cough. Symptoms often look harmless at first: runny nose, mild cough, low-grade fever. Easy to ignore. But after 1 or 2 weeks, the cough intensifies, sometimes producing that classic whoop sound. I was trying to show that, but I don't have it, so. It can lead to vomiting and difficulty breathing, especially in infants. Infants under 1 year old are at the highest risk for severe complications. And for them, whooping cough can be deadly. Adults with weakened immune systems, chronic respiratory disease, or moderate to severe asthma are also at an increased risk. Like most respiratory illnesses, whooping cough spreads through the air. When somebody coughs or sneezes, they're releasing droplets containing bacteria, and people can remain contagious for weeks, even though antibiotics can shorten that time. Now, what's the big question? Why is it surging so early? Public health experts point to several factors: falling vaccination rates since the pandemic, waning immunity over time, the shifting federal health policies that have fueled confusion and skepticism. To reduce the spread, the CDC recommends washing your hands often, covering coughs and sneezes, staying home when sick, and if diagnosed, follow your provider's recommendations. Antibiotics can help contagiousness. My grandkids all show me this chicken wing thing where you cough into your arm so your hands don't get it. The CDC continues to recommend vaccinations for everyone. There are 2 types: DTaP for children and Tdap for preteens, adults, and those who've never received the vaccine. These vaccines are effective, but the protection fades over time, which is why a booster can matter. Tomorrow on UroNurse News, I dive into a game-changing development in healthcare. For millions, a rare disease diagnosis means years of uncertainty. But a new artificial intelligence model, you know how I like AI, is breaking the timeline, spotting patterns the human eye might miss, and ending the diagnostic odyssey in record time. So, is this the future for urology and specialized nursing? And what does it mean for patients? Don't miss this critical update. So, as the early surge continues, awareness and prevention remain our strongest tools. You and your child, if you or your child develop a persistent or worsening cough, don't wait. Talk with a healthcare professional. So stay informed, protect yourself and everyone around you. I'm Vic Senese. This has been UroNurse News, and you know what to do.
Deck the halls with updates and cheer. Trusted insights throughout the year. With every story